What is going on, my creation RNs? I hope you all are having a wonderful day. I want to touch base a little bit more in regards to my travel nursing series because I get this question quite a bit. It is, how do I get over my travel nursing anxiety and 7 tips on how to get past that. Stay tuned. To be prepared. Make sure that you have spoken with your travel nurse recruiter or the facility to make sure what specific colored scrub that you need to be wearing. Make sure that they're ready, they're pressed for you to go on your first day. You also want to make sure you have your first day paperwork all laid out for you. You don't want to be rushing that morning, trying to get ready, trying to get all your stuff together and try to get out of the house, and it's not going to work. Trust me, I've been there. Make sure that you're prepared. Tip number 2 is to know where you are going. I cannot tell you the biggest mistake that I made when I first became a travel nurse was I did not know where the facility was the day that I needed to be there. I was extremely late to my orientation because I could not find the facility. It was out in the middle of nowhere. Luckily, I found it. However, again, I was late. So make sure you know where you need to park at that facility. Make sure you know where you need to report, what time you need to be there. My suggestion for you is to get to wherever you're going a couple days ahead of time. Get everything unpacked, get ready to go, and then the day before you actually start your travel nursing assignment, actually drive to the facility and see where the facility is. That way you can time how long it takes you to get there, as well as where you need to park and where the specific locations are that you need to be that day. My third tip for you is to be a learner. On your first day of orientation, you want to make sure that you are actually present in the moment and listening to what the facility is telling you. They give you a lot of tips of what's going on in the facility, as well as what is expected of you and what you can expect for them. Make sure that you're taking notes. That is the number one most important thing that I can recommend because you might not necessarily remember everything. However, you can always go back and reference your notes if you need to. If you ever feel uncomfortable in a situation, when you go to orientation, always contact your travel nurse recruiter because they can actually help you. They should have your back. If your travel nurse recruiter does not have your back and tell you to deal with it, my recommendation for you is to probably not use that travel recruiter anymore because they should have your back and they should be able to answer questions and make you feel more confident in the place that they have placed you. And like I said before, ask questions. The number one thing that you want to do is make sure that you ask as many questions as possible, whether that be with your recruiter or whether that be with the facility. The hospital is there to help you and support you as a travel nurse because they need you. So if you have questions about things, make sure you ask. If the facility is unable to answer questions, make sure you ask your recruiter and get a definitive answer on those questions to help you be more confident in your work. When you finally finish that orientation and you get on the floor, you want to start initiating communication between you and your coworkers. You want to offer that smile, you want to shake their hand, give them a nice firm handshake, and you want to tell them your full name. That way they know who you are and they know what you're there to do. Also, my suggestion is if you want to get on your coworker's good side is offer as much help as you possibly can without drowning yourself in familiar tasks that you are aware with. If they need help lifting up a patient, if they need help holding a leg because they're placing a Foley catheter, whatever the case may be, help them initiate that communication, and that way it'll be a little bit more smooth when you're doing your travel nurse assignment. My next tip is to take care of yourself. With anything, when you travel, it can be stressful when you're starting a new place. It can be very, very stressful. So I always recommend that you start taking care of yourself. Make sure that you're getting a good night's sleep. You're waking up in the morning to have a healthy breakfast and meal to get you out the door for the day. On your days off, make sure you're allowing time to exercise, meditate, make friendships, communicate, have travel adventures. Anything you can possibly have to take care of yourself. I always, whenever I traveled, made sure that I got a nice massage at least twice a month because honestly, what we do is very stressful and very labor intensive, and sometimes you just need someone to help take care of you. And lastly, maintain your confidence. Honestly, one of the biggest things that I get in regards to travel nursing is some people start to lose their confidence. Just remember that the facility hired you because they know that you can do the job. They know you have the skills. They know you have the expertise. Don't let your nerves get the best of you. I know it's very difficult moving to a new place temporarily and having to start a new assignment and make new friends, especially if you're on your own. Make sure that you maintain your confidence. Make sure that you keep in contact with people from back home that help lift you up and put you in a better place and help you know that you are the best nurse out there. So those are my 7 tips to help you overcome your first day travel nursing anxiety. I hope that this helps you. It really helped me when I first became a travel nurse, and I continue to do this with all of my assignments. Make sure you follow me on social media. I have Instagram, Facebook, and Twitter, as well as you can follow me on my blog, creationrn.com, where I go more into detail regarding every topic that I talk about. I hope you all have a wonderful day, and I look forward to speaking with you again soon. Bye-bye.